Well, a crucial CDC decision pushed back to today. A vaccine panel set to vote on the future of the hepatitis B vaccines for newborns. So members of the board, they were supposed to make the call on Thursday, but advisors say there was confusion due to last-minute changes in the wording of the vote. This marks the second time the panel has stalled on the Hep B vaccine for newborns. Joining us now, nephrologist and expert in pediatrics and obesity medicine, Dr. Frita Fisher. Dr. Frita, thank you so much for your time this morning. So the panel cited some confusion over what exactly they were voting for when it came to whether or not they should be making changes to the Hep B shot for newborns. What's the issue at hand?
The issue at hand is that they are proposing making changes, but there's no data, no new evidence to support these changes. We know that hepatitis B is a deadly virus, and prior to us recommending that newborns within the first 24 hours get the hepatitis B vaccine, we lost 18,000 children each year. We had 18,000 infections with hepatitis B in children each year. Now, since we've had the vaccine recommended, we only have about 20 cases per year. And so we know that the vaccine is safe, we know it's effective, and we know that hepatitis B is highly contagious, even more contagious than HIV and hepatitis C.
Yeah, so I want to dig into some of these recommendations, but first, do you foresee another delay in the vote today?
I do actually hope that there's a delay, because if the people who are voting are doing it based on evidence, if they're voting based on the safety of children, if they're voting based on the safety of Americans, and if they're voting based on the evidence, then they actually have no reason to vote to change. And so I foresee either a delay or them leaving things the way that they are, because again, the hepatitis B vaccine is safe and it's effective. And we know that hepatitis B is a leading cause of liver cancer. And with children specifically, if they have the hepatitis B infection, they don't clear it as easily as adults. And 25% of children who get hepatitis B will pass away prematurely from liver cancer, it's predicted.
So there's been some issue with how could children get hepatitis B unless there are some extenuating circumstances. I want to dig into that now. Axios reporting the committee's considering recommendations that parents should consult with a doctor about whether to give their infant the birth dose of the Hep B vaccine if a test shows that the mother doesn't have the liver illness. So I don't have a medical license. That seems reasonable to me. Do you have concerns with that model? And if so, what are they specifically?
Here are the concerns, Kelly. We've been there, we've done that. In 1982, we actually were surveying mothers, and we were trying to only give the hepatitis B vaccine to mothers who were positive. Unfortunately, it was not effective, and we still had 18,000 cases of hepatitis B in children less than 10 years of age each year doing that surveillance. So we tried something different. Since 1991, we've stopped the surveillance, and we have reduced the cases to a minimal number. Here's the other thing. Infants are not only at risk from mothers who have hepatitis B, and it's not just IV drug abusers or people who have, unprotected sex. You also can get it from toothbrushes, from razors, from scratches. Babies can get it from caretakers. There are reports of babies who have gotten it from their grandparents. And so it's larger than just babies getting it from their mothers. There's a high risk from this highly infectious virus, and we have no definitive cure. What we do have is prevention. It's been working. If it's not broken, why try to fix it?
All right. Well, it's a difficult landscape for parents to navigate right now. I appreciate the clarity this morning. Dr. Frita Fisher, always a pleasure. Thank you.